y'all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here, just give me 1 second to check my audio. Okay. If you're new here, welcome. I noticed there's been some new subscribers to the channel, about 10 or 15 new subscribers in the last week. So welcome to everyone who's new. I appreciate everyone who has been sharing the page. If someone referred my page to you, or I'm glad the algorithm brought you to me. If you are to this space, if you are a new subscriber, just please leave a comment below and just say new subscriber so I can welcome you into this space. Or if you're comfortable sending me a message, my contact information is in the description box. So we're on a road to 700. I think I'm at 650 or so. So I'm hoping to get to 700 subscribers by the end of April. I would appreciate it. So if you could, please do like the video. Liking and sharing the video does two things. Number one is you telling the algorithm that you find this information useful, helpful, and engaging. And then number two, it encourages me to continue creating content that you all find interesting and helpful. So today I have three topics, and I'm going to try to keep this under 30 minutes. First, I'm going to respond to, and I'm going to share my screen. I'm going to respond to a viewer question that someone emailed me. So, sometimes when I get questions either in my email or in a comment on a video, instead of just responding one-on-one to that person, either in email or just in comment, I'll do a video because it helps more people. It's helping more than just that one person. Other people may find the information useful. So that's why you'll oftentimes see me do a video response. And then I'm going to talk about just some news articles that I came across over the last couple of days with some innovations for artificial intelligence in healthcare. I'm very much interested in AI and healthcare. I follow it closely. That's why you all see me talking about it more and more. I really think it's important for nurses to have a seat at the table, or just understand as these technologies are being implemented into electronic health workers or being implemented into the technology tools that we are using to take care of patients. So we are at the forefront, and our voices are being heard, and our input is a part of those innovations. And then I want to share an interesting news article I actually came across about 3 or 4 weeks ago, but I've been so busy I haven't had a chance to share it with y'all. So I'm going to start with the question that I received. Oh, let me do my disclaimer, because y'all know I love a disclaimer. I'll be sure to leave a link to all articles that I talk about in the description box once the live is done. And then also, this person who asked the question, I always like to give a disclaimer with just anything I talk about. Well, we use on my own, number one, but please do not believe everything I say, okay? Please always do your due diligence with anything that you come across on the internet, right? Not just me, but just anyone. Always please do your due diligence, okay? Don't just take something that me or any other person on social media talks about and just run with it, okay? And then and then also, this is just my opinion because the person asked for my input. So, yeah, I'm just one person. So, if you are an experienced informatics nurse or clinician working in tech, and you have different advice for this person, please do leave a comment, right? Because what you believe based on what they asked may be different. Okay, got that out the way. So, let me share my screen. Oh, give me one moment. Here we are. Okay, let me make sure that's sharing okay. Yes, it is. Let me make it bigger. Can y'all see that okay? Okay, good. So this person sent me an email actually yesterday on April 11th. Today's April 12th. They said, good morning. They have been checking out some of the content. So this person says they have been a nurse, an LPN, since 2012 with 8 years of experience being in pediatric home health. That's awesome. Congratulations. 8 years is a long time to be working as a nurse. Okay. And so they recently got their RN license last month. I would love to get into informatics, but I have no related experience. Okay, I have never worked in a hospital, only in a nursing home for a couple of years. Is it possible for me to get a job in informatics given my limited experience? If not, where should I start? Is it possible to move into that field if I don't want to get experience as a bedside nurse in a hospital first? I've also considered UX UI design. So for you all who don't know, UX UI design is like end user design. So designing like functionality, making the functionality of a technology tool, system, etc., user friendly and conducive to operational workflows. So I have also considered UX UI design because I'm a creative person and I like problem solving. Is this something that can be uniquely bridged with informatics? Okay, so there are several questions in this email. Okay. All right. So I see one, two, three, four. I see four questions in this email. So I may not because they're asking a lot in this one email. So I may not answer like all four questions, but I'll answer as much as I can with the time that I have. Okay. So the first question is, I have never worked in a hospital. Is it possible for me to get into informatics given my limited experience? First of all, you have a lot of experience. I don't want you to discredit your experience as an LPN and the fact that you just got your RN license last month. Even though you've only had your RN license 1 month, you already have 8 years of experience being a licensed practical nurse in pediatric home health. So please don't discredit your experience. You say it's limited experience, but I see you as having a lot of experience because you have 8 years of being a nurse in pediatric home health. And the reason why I say don't discredit your experience, you say you have limited experience, but I just don't want this person to downplay their experience. 8 years is a long time, right, to work in a specialty because you have 8 years of pediatric home health. You didn't say how long you had worked in a nursing home. So to me, you have a lot of experience in home health, and that definitely goes a long way. Okay, so that's the first thing. I don't want you to not decrement, discredit yourself. That's not the word, but I can't think of the word. So you have a lot of experience. So to answer your first question, yes, it is possible for you to get a job in informatics given your experience. And the reason why I say that is although you've only been a registered nurse for 1 month, you have been a LPN for 8 years. And I do know of LPNs right now with experience like yourself who are working in informatics. So that's why I'm saying please do not discredit your 8 years of experience in pediatric home health. So, absolutely, I say yes, it is possible to get a job in informatics. Um, so, okay. And then I'll just again because you asked so much in one email, I'll just answer maybe one more. And so you said, okay. So then I'll just answer like the third one. Is it possible to move into the field if I don't want to get experience as a bedside nurse in the hospital first? Yes, it is possible to move into informatics. It just depends on what you want to do in informatics. It sounds like you already have an idea of the type of work that you want to do, which is UX UI design, and I do believe it's possible. So I will say you don't necessarily have to be a bedside nurse in a hospital first because you already have 8 years of experience as an LPN. So you have that clinical knowledge as a home health nurse. You now have your registered nursing license. To me, that holds a lot of weight. But it just depends on like the type of company you go to work for, the type of work that you're doing. So I hope that helps. I just don't want the big thing is you have a lot of experience as a nurse, and I just don't want you to forget that. Okay, so hopefully that helped you, the person who sent me this message. And so yeah. Okay, y'all. All right. So now I'm just gonna. Oh, good. We're only 10 minutes in. I wanted to try to keep this under 30 minutes. So now I'm just gonna talk about. Just share some news articles that I came across. Um, AI. I'm very much interested in AI. That's why I love keeping up with what's new and what's coming with it, because I think it's really important for nurses to have an understand. You don't have to know everything about it, but I mean, I don't. You may not have to know everything about it, but I just feel like it's important for nurses to be aware of it. So as these innovations are coming out or being implemented into our daily operational workflows, no matter where you're practicing, you just have like a general understanding. So I came across this really interesting article. Yeah, I know I've talked about Becker's before. Becker's have a lot. They have a lot of news. That's how I get a lot of my information. It's one of my primary sources, along with some other mailing list that I'm on. So John Hopkins is now using facial recognition technology for stroke care. So I find this really interesting, this AI news, because now just because this is the first time that I'm seeing something doesn't mean that it's new. It's new to me. So this is the first time that I'm seeing, that I can recall seeing, facial recognition technology being used in healthcare beyond just like, I know there have been facial recognition technology used for like the registration process. I know many hospitals and large health systems use the facial recognition technology for like the registration process. So when the patient goes to check in for like surgery or like their doctor's appointment, like it scans their face. You can scan their faces on the patient side. I know it's like on the IT professional side, but I believe this is the first time I've seen facial recognition technology in healthcare. Prior to this, we've seen it used in the criminal justice system, law enforcement. I remember many, many years ago when the first facial recognition technology was being rolled out, or the awareness was being shared with the public, how it's being used at some like large sporting events. I believe, don't quote me on this, but I believe possibly that it's being used at like large events like the Olympics. So, the people, as they're going to the games and things, they have these cameras and things that can scan people's faces to see who's in the crowd. And I know they've used it at, I believe they've used it at the Olympic events overseas, and I believe they may also use facial recognition technology at like large NFL, etc. type events. But so John Hopkins, which is in Baltimore, Maryland, is training a computer algorithm to recognize changes in a patient's face and identify signs of stroke. So the WSJ, or the Wall Street Journal, did a long article that came out on Monday of this week, April 10th. It's behind a paywall, but if you sign up for if you sign up like with your email address, you can read it for free. There are a number of articles you can read for free, so I won't share the longer one. But it says by identifying stroke patients through facial recognition rather than brain scans or blood tests, clinicians can speed up the treatment process. That's like a key thing that jumped out to me. The computer algorithm is being trained, machine learning, is being trained to recognize signs of stroke, such as the paralysis of specific facial muscles or unusual eye movements. My nurses, my clinicians out there, the signs of a stroke can include asymmetry in the face, or like tics and things like that. The face is probably one of the most sophisticated signaling signaling systems in the universe. And then they have a director of precision medicine and a chief of the division of informatics. Maybe we could actually measure what's happening and then leverage advanced analytical techniques and AI, artificial intelligence, to process large amounts of information and generate new insights. So I find this interesting. I did an article, I did a live, maybe about 2 months ago, where researchers at Duke Health AI um, found that stroke algorithms do not work as effectively for patients of color, and they overwork for non-patients of color, meaning the algorithm would be recommending treatments for non-patient colleagues unnecessarily. So people were unnecessarily receiving treatments, whereas patients of color were being overtreated or unnecessary, or were not being treated, where people who didn't need the care were being treated. So anything around like stroke and AI, I'm very much interested in. So yeah, so that was the first story. Let's do a quick time check. Cool, we're 16 minutes in. The second one, I'm gonna do this last one, this fraudster, because it seems like, especially, it seems like fraudsters are running rampant in healthcare. The second one is another AI tool. So Cerner, not Oracle Cerner, not the Cerner that's being associated that I did a story on, but Cerner is developing AI tools to extract clinical notes from the electronic health record. Now, this story jumped out to me because with what Cerner is doing with the Food and Drug Administration, is they're going to be using AI to get not only extract information from clinical notes, but unstructured data. And if you've ever been an informatics nurse or worked in any type of data analytics or et cetera, a difficult thing is to get notes from an EHR that's unstructured. So when I say unstructured versus structured, I mean you can have a structured, for example, a structured field would be wound abscess. Unstructured, and that it would be wound abscess no matter where you look in the application, or it's always called that, versus someone else like me as a nurse may call it abscessed wound, or someone else may say wound that is abscessed, or the wound looks absent. Like, so when it's unstructured, it's more challenging to do analytics and data analytics on unstructured data. But what Cerner is doing is there's a new tool that they're developing will be able to look at unstructured and capture unstructured data. And they have like a longer article on PR Newswire that I'll leave in the description box. So Cerner is working with the Food and Drug Administration in Johnson Labs to develop tools that can extract notes from the patient's EHR. It is a 2-year partnership, and this is interesting because I'm seeing more and more health systems, either through Becker's and like Forbes, Wall Street Journal, and the other outlets that I'm finding. I'm seeing to me, that just seems like to me there's more and more partnerships happening between like traditional technical companies and then traditional hospitals, and they're coming together. So you have like the technical companies that have all of the IT experience or the technology experience, and then you have the health systems that have the clinical piece, and they're coming together. So this is a 2-year partnership, and they're developing a new method to improve computerized queries of digital patient data and clinical notes with the aim of enhancing pharmacoepidemiology. And the project is dubbed the Multi-Source Observational Safety Study for Advanced Information Classification using NLP. And NLP, for you all, is natural language processing. It's a type of AI. And it aims to help the FDA recognize how machine learning and it says right here, and natural language processing can help analyze the effects of medicines on large populations. And specifically, they're going to be looking at asthma drug Montelukast and how it affects patient populations. And again, there's a longer article on that. And the last one that I was going to share, just recent news around AI. Now, this one was interesting to me because I believe this is the first time. And again, just because it's new to me doesn't mean like, it's super new. I'm just saying it's new to me. Where Chat GPT is being used in healthcare, well, intended to be used. And so Boston Children's Hospital, I went to the job opening. I was like, "Ooh, what does it look like?" And I'll read. I don't want to share the LinkedIn because it has my personal information. You have to actually log into LinkedIn to see the job description. But Boston Children's is hiring an artificial intelligence prompt engineer to work with large language models like ChatGPT. Now, I've seen some ChatGPT job positions, and they're paying salaries up to like $200,000-$300,000. So we're not talking about a couple of pennies, y'all. So the engineer will be part of the hospital's innovation and digital health accelerator team. The person will develop and design prompts to effectively gather data from generative AI such as ChatGPT, programs and refine the models for healthcare specific applications. They're looking for someone with a background in AI, machine learning, data science, NLP, as well as experience in healthcare research and operations. This is wow. The position requires a bachelor's degree in a field such as computer science or AI with a healthcare focus and a master's degree preferred. And I have the job description pulled up on my other screen. Y'all can't see it, but I'm looking at the job description. So specifically, they want someone with 5 years of engineering, developing coding like in Python or a similar language, experience with at least 2 years experience in AI and natural language processing, experience with machine learning libraries such as TensorFlow and PyTorch, team environment, communicate effectively with non-technical stakeholders, which I'm assuming would be like being able to communicate effectively with clinicians, but they're really big. It says here you have to be familiar with Python or similar languages, and you'll be doing things like performing statistical analysis, interpreting test results, evaluating the performance of the AI prompts. So yeah, I think I'm just fascinated because this is the first time for me I'm seeing a Chat GPT prompt engineer position in healthcare, and based on all of the news and happenings with uh, with Chat GPT and AI, I have a feeling there's going to be more and more. And Charlie, yes, we are back. We are back. I'm glad you were able to make it back. So yes. All right, y'all. So the last thing, y'all know I love a little bit of tea. Oh, good. We're only 22 minutes in, and I was going to try to keep this under 30 minutes. So this last one. So this last story caught me because I think about the quote unquote nurse Eugene, that scandal that came out last month, where the nurse Eugene on TikTok pretended to be a nurse, said that with all that's happening with nurses and workplace violence, said that they got attacked and had all of these nurses and non-nurses, people just donating to GoFundMe, and it come to find out that person was a scammer. And now they have just kind of like disappeared off the internet. So this one says teenage imposter gains access to 2 Corpus Christi hospitals. He got a badge. I don't know if it's a he or she or a they. They got a badge, and they had free reign of many of the hospital's most critical areas. Now, anytime a person who is not a clinician or has no business being in patient care areas, I'm always on alert. When I worked in the hospital, I'm always known for nurses, in the type of nursing environments that I worked in. Nurses have always been very protective of their patients. Just like people, just part of the work that we do, working the floors, being in the med stations, going on in and out of patient rooms. Nurses I've always worked in the past in the facilities were always just keeping an eye out, a side out for anybody going in and out of our patient rooms. Very protective. Nurses I've worked with in the past, very protective of their patients. And it looks like, based on the article, it was the nurses and the nursing staff that picked up on that something was not right. So let's get into it. So for nearly a month, y'all, this person had access for almost a month. The teenager posed as a medical professional and gained access to 2 Corpus Christi hospitals. Y'all know I have questions, because that's a long time for a fraudster to have access to vulnerable patients. Patients, sick patients in a hospital or a medical facility like a SNF, etc. They're vulnerable, especially if they're not able to, if they're like a total care patient, or they need like assistance with their activities of daily living. So an investigation by the Corpus Christi Police Department, so this was down in Texas, that is just one thing that the person faked. And so let me go down. So, because I was like, well, how did he get it? All right. So the documents. So they got some documents. Bank fraud. This person purchased a $52,000 BMW. They drove that car from Missouri to Corpus Christi, Texas, 2 days after the purchase to visit his 15-year-old girlfriend. I think this person was 19. I think I saw in another article. I think they were like 18 or 19. I'm going to get to the part about how he got it. Here we go. All right. So, according to court documents and the police, the teenager purchased $41 worth of scrubs from Scrubs R Us. You know, anybody can go into like a Walmart, Target, variety wholesalers to buy scrubs. After having those scrubs in hand, their next stop was a Corpus Christi hospital. It was at Corpus Christi Medical Center's Bay Area Hospital that the teenager dressed in scrubs went and asked for a badge. Documents and witness interviews state he claimed to be a traveling physician assistant. That's not unheard of. I've heard of traveling nurses. What do they call the physicians that have those special assignments? Locum physicians, traveling physical therapists. So, I mean, excuse me, traveling occupational therapists, etc. So he just went to human resources and said, I need a badge. And they had a volunteer coordinator manning the office and manning the desk that makes the badges. The volunteer coordinator said that she had reservations about making a badge for Bailey, was told to make the badges for staffers requested. Quote, they basically beat it into our heads that we needed to be all about customer service. So I was like, okay, if you send me a picture, then I can get your badge started for you. This is not funny. I'm just like, got a little bit exasperated there. Then they're protecting the name of the staff, the respect the privacy of their current and former employees. So, and that's fair enough. And I do believe later on in the article they said that the volunteer coordinator is no longer with the facility. Um, it says that the employee did tell, she informed their supervisors the same day about the incident, the same day, especially with Bailey's age, but nothing came of it. So it wasn't like the employee or the volunteer coordinator just created the badge and just, did nothing else. They actually reported it to their supervisor, but nothing got done. So, I mean, that's a red flag to me. I mean, if you're not used to working in a medical environment, someone 17, 18, 19 saying they'll be a physician assistant, that's an immediate red flag. Not to say it can't happen, but I'm like, not only are you a physician assistant, you're a traveling physician assistant, and usually travelers don't, at least on the nursing side, you don't start traveling at least for like a year or two. So it would have been red flags immediately for me. But again, I've been a clinician, a nurse for several years. So if you're not familiar with that, maybe it's not as, a big of a red flag. With a badge in hand and disguised as a medical professional, the teenager was able to access two Corpus Christi hospitals, and they named the hospitals. They discovered he also tried to obtain a badge from the Children's Hospital, from Driscoll Children's Hospital. Was it not? Um, the police spoke with an HR recruiter at the Children's Hospital and said that the teenager called and then showed up to the office seeking a badge, claiming to be a traveling physician assistant. The HR recruiter said that Children's Hospital has no such position and that he did not appear on any list for employment. And that's the thing. Usually, by the time a true employee shows up to get a badge, they're already kind of like in the system, right? So it's not just some rando off the street showing up to get a badge. Yeah, and so the HR recruiter said that once he was notified, he stepped out the room. Baylor said he called his recruiter and then claimed to be at the wrong hospital. But from the other two hospitals, he was able to, with his badge, because once you have a badge, most hospitals today have when you go into like different areas of the hospital, you have to badge in. And just know that most hospitals these days have a breadcrumb for everything. When I say breadcrumb, I mean a breadcrumb for when you log into the system, a breadcrumb for where you click in the system, a breadcrumb if you print a patient's chart, a breadcrumb for every door you go into. And if they don't have breadcrumbs, they have cameras. So most bigger places have where they can like track the footprints or like the path that someone took through the facility. This facility did that, and they said badge swap show he accessed the emergency room, intensive care units, the operating room, the catheterization lab, and nursery units. So for those not my non-clinical people, the catheterization lab, those are the labs. That's the places, like if someone has a heart attack, where they take them to like open the arteries in the heart. They do the catheterization, so they do those type of procedures, and the nursery unit, the baby. This kind of got me. All right, so it also indicates he was denied access to other areas of the hospital, including the operating room, locker room, physician's parking gate, physician's parking, and operating room control room. I don't know what his motive would have been with babies, but I mean, like, it's scary that he can even get up there. It's definitely not comfortable knowing that someone was able to do that. And I said the same thing. I was like, ooh, because PAs, they can write orders, they can do treatments, they can do procedures, things like that. What if they gave you some random medication for a patient and it harms them? That's end quote. Hospital surveillance video showed that the teenager entered doctor's lounges and changing rooms in one pair of scrubs or just plain clothes, and then exited those areas in scrubs or doctor's coats belonging to others, using his scrubs and badge from the hospital. The police said he also gave fake information to obtain residency at an apartment complex, stating that he made $28,000 a month. How much is $28,000? If you get $28,000 a month, how much is that per year? I'm just kidding. No, 12. Oh, $336,000. Okay. So staff at the apartment told he would frequently come in the scrubs, being in gift baskets, including Apple Watches and other goodies. Wow. Let me do a quick time check, y'all, because I wanted to try to keep this under 30 minutes. Oh, Lord, I'm at 32. So let me wrap this up and see how he got busted. So what busted was the nurse, the ICU nurse, because that's what I was saying from the beginning. Most nurses that I've worked with, I think all the nurses I work with, we've always been just leery of people that we don't know or recognize going into our patient room, just for the safety of the patient. So usually if you work in a hospital, especially once the patient has been there a couple of days and you're talking with the patient, or if they're incapacitated, talking with their families, you kind of get used to the faces coming in and out. People have visitors, but still, most nurses I know just keep an eye out on people going in and out of patient rooms, especially people, even if they have scrubs on, right? Because you're like, well, who is you kind of get used to the doctors and the nurses and the therapists and the social workers. So you may see someone you don't recognize going in, even if they're having a lab coat. Most nurses I know will kind of keep an eye out. And it was the nurses who caught them. So they said one of the ICU nurses said the teenager was just talking about other doctors that work there, talking about other nurses, talking about his girlfriend and cars and just all kinds of stuff. And the more he was telling me, the more he was talking, the nurse said, I just felt something is not right. And she said, or they said, I don't know if he was specifically asking for access to the computer, but he was just mentioning that he doesn't have access, which you need a 3 to 4 ID, and he was asking how he gets access. That would be a red flag. Like if you're new, even if you're new, getting your access set up is one of the first things they do. But in hindsight, one nurse said it appeared something just wasn't quite right. He said it was a community college that he went to called Stevens College. And then Stevens College is actually an all-girls school. He's saying that he's a PA. I was like, this kid looks 12 years old. I just don't believe anything he's saying. And then the nurses went to this teenager's social media. They said they figured out that he was not who he said he was. And then they got everything disabled. So, yeah, y'all. The badge coordinator doesn't work there anymore. And then looks like they finally caught up with him. They impounded the car using that he was able to obtain with fraudulent funds. And they got the scrubs that were taken. And I think also, yeah, here we go. He was arrested, and then after being released on bond, he was arrested again a month later after violations of a GPS. Whoops, sorry about that, y'all. Oh, this looks like one of the fake prescriptions, I guess they wrote. Something I clicked on. Sorry about that. Yeah. Anyway, looks like he left the state unauthorized as well. I'll leave a link to this article because this is going a little bit longer. Sorry about that, y'all. I try to keep it 30 minutes. So, yeah, be careful, y'all. thanks for everyone who also sends in questions. So I hope that helped the nurse, the LPN, the question at the beginning. If it did help you, leave a comment below. Or just follow up with me back in email. Thanks again, and welcome to the new subscribers to the channel. If you're watching the replay, you can put replay or just send me a message to let me know you made it this far in the video. Take care of yourself, y'all. Right? Take care of yourself and watch out for your loved ones and your friends as well. And I'll see y'all in the next video. Bye now.